Cindy Duke.
Hi everyone, so I'm Dr. Cindy Duke. I'm a board certified OBGYN, reproductive endocrine and infertility subspecialist, as well as a virologist. So I spend a lot of my days communicating about vaccines, vaccine immunology, and health equity.
So Cindy, I wanted to ask you, so, we've seen, especially here at this conference, there's, the digital passports and mobile devices, and, clearly that is sort of a feature that we're going to be using to travel. But how do you account for the digital divide and this issue of access to technology? Is that a fair issue, or are people pointing that out, as something that is actually not realistic?
It's a very fair issue, and one that is just amplified in the pandemic altogether. So there's so many things that we have been relying on that for many communities that have been historically under-resourced, they haven't been able to rise to the challenge that this pandemic faces. So whether it was talking about remote schooling, Zooming in from work, a lot of the things that we now take for granted for communities that were already under-resourced, where they don't have Wi-Fi, where they don't have telephones or other devices that actually can access such services, that wasn't possible for them. So now we're talking about things like vaccine passports. Clearly we have that here, such an amazing thing, but for many communities, that's not something that's even within reach. And so we have to think of alternatives at every step of the way. If you are someone who has a company that can invest in such technology, we have to start thinking about how do we make it accessible to those communities. It's not just, well, my cousin, my friend, I was able to help them with this technology. It's what parts of this country still don't have broadband internet access? What parts of our country don't have access to these smart devices that we now take for granted and have multiples of in our households?
Been to a goat rodeo, which is now our
Another
life.
side to that exemption issue is the communities where English is not the primary language. And we haven't been reaching those communities very well. And many of those communities, of course, who they view as leaders are people within their religious sect. And so what I found, and I work out of Las Vegas, we have a very diverse population, is whenever we get the exemption request, and I get religious exemption requests, and I get the request, which is, well, can't you tell them that as a fertility doctor, you don't recommend me getting the vaccine? And so the first thing I ask is, what's your religious affiliation? Because the truth is, most major religious groups, whomever is seen as their head or their primary person has actually made a statement. Most of them are unaware of it, especially if English isn't their primary language, because they're trusting the local representative who is oftentimes misinformed, might even be participating in active disinformation. But I do give grace and say maybe they just don't know. And so I've offered to come to their churches, wherever that is, show up with a member of the community that they trust who speaks their language and answer questions, because I think that's a big part. But I really think for the most part, many of the people who are seeking religious exemptions don't know that their religious entity doesn't actually say vaccines are bad. Go ahead. I think that misses the scope of the problem though, right? So for example, if we go back to the children issue, one of the things we have to keep in mind when we talk about why we're vaccinating kids is the overall impact that COVID has had on children, right? So people are arguing, let's get them back to school. Well, we need to get them back to school safely, because while most kids do okay with COVID, that classmate that won't do well is going to traumatize the rest of the kids who were part of that. The number of kids who've lost a parent, if we look just in the United States and you look at communities of color, you look at children, Native American ancestry, Black, Hispanic, we have 1 in 168 Native American children have lost at least one parent, right? And so when we talk about COVID and its impact, it's not just one person, it's what the loss is if we don't get as many people vaccinated as possible, hence the reason for vaccines. We know actually about these technologies. So in so much as mRNA vaccine for COVID is only maybe 2 years old, the mRNA technology has been studied and has been pretty well represented in terms of safety profiles for going on 10 years. We need to get out there and help people understand that part. And then secondly, treatment. treatment is for those who get sick. The treatment will never protect the community. It won't actually bolster economics, if we look at it that way, and certainly protecting parents and grandparents. And so we have to think of the big picture when we talk to them about it.
Right.
And I think along with that is a necessary complement, which is public education, vaccine literacy, health science literacy. We actually saw a disinvestment in that as well over the last 3 decades or so. And so what we had was just both of them coming to a head, right? Disinvestment in public infrastructure, disinvestment in how public officials can communicate with the public. But then what we also had was the public having less and less understanding of the necessity of a public health infrastructure, of people understanding that our health system was designed for a healthy population, not for a surge of people being unhealthy all at once. And so, for example, the argument about children, hospitals, etc., most people don't understand. Most people never even knew how many ICU beds were available in their community until very recently. And they're still confused because when they see an empty bed and they see one person posted on social media and they say, see, the CDC is lying to you, we have beds. Well, beds need staff, they need doctors, they need nurses, they need ventilators. We haven't educated the public on that. And so people vote, they believe that taxpayer dollars are at work, but they don't know how it's working. And so I agree, it's not about KPIs or quarterly numbers. It's what's our overall goal here for the public. All right, I'm not a fan of the term vaccine confidence, but I'm also not a fan of the term breakthrough infection. And there's not a single textbook you'll find breakthrough infection written in either. I think what's important when we talk about communities that aren't accessing vaccines is asking the questions we started talking about at the beginning, which is what's keeping them from gaining that interest in the vaccine. And I think one really good example we have in this country is the Indian Health Service. And what they did was they said, let's give the vaccines ourselves. We're going to give the vaccines using the people who've been in the community, who they trust. We don't want new people coming in to administer vaccines. And yet that's what we're seeing right now in many communities that are opting out of vaccines is, sure, maybe we took a truck to them, but it's a truck full of people they've never seen before. And so if they hadn't seen the health service coming in, being considerate of the homeless before, they're not considerate of the kids who couldn't afford to go to school and actually have nutritious meals, why are they going to believe you today when you show up with a van after they've been hearing that tests are coming and these vaccines are real? And so I think we have to spend more time asking ourselves, how are we going about these community access protocols and where have they done it well? And I would say the Indian Health Service, which is a federal health dispensation service, has actually done it well. We have an example. As for international locations, I really think we need to think about this as more than just vaccine diplomacy. To use the analogy of the fire truck, I grew up in the Caribbean and we always said, if your neighbor's bed is on fire, you wet yours. And that's what's happening here with this pandemic. You know, we're not going to get back to our full conferences. We're not going to get back to hospitality the way we want to see it until the other countries have vaccines that are equitably distributed, not 2%, 3% of their population being vaccinated. Of course, also Americans want to go everywhere. We need to vaccinate other countries. I would say, you know, COVID really is the defining force for healthcare in this millennium, in this century and going forward. There'll be textbooks written about it. The way we deliver healthcare, the systems we design, etc., will be very much determined by what we learned from the pandemic and what we're still learning in the pandemic. And so I really think to everyone in the audience, no matter what your field is, what your industry is, the question is, what does COVID mean for you? And how you can help integrate this system going forward. And it means interrogating not just your company, but your community and the communities that you're interested in. It's not just about the bottom line. Thank you.
That's great. You know, and we're right on time, exactly, so that was amazing. You know, I could sit here and listen to you guys for hours, truly. It could be a whole conference just unto yourself. So I want to thank you. Please give them a round of applause. And thanks so much.